So earlier this week, Monday and Tuesday, today's Wednesday, we went to Stanford, and on Monday I had a PET CT scan, and I haven't had one since November of 2017, and right now it's May of 2018. So I was really nervous actually about that because over time I've felt a lot in my sternum, heart, breathing, a little bit in my throat, and I didn't get the final report, but the doctor who was doing the biopsy yesterday said that she looked at it and she said that it looks good, basically. It looks like there's no spreading and that actually the tumor is even smaller. The tumor in my breast, and then there's also the axilla, the lymph node in the armpit, actually looks smaller. So it was really encouraging news, and I can't imagine she would have said that if she didn't feel confident to say it, because usually they're way more guarded than being effusive in what they tell you. So it's really good. I think that probably next week we go back down on Monday. I'll get the actual, exact findings and images and stuff like that. So that was really good. Getting that. So PET CT on Monday, and then Tuesday I went in and first they did an ultrasound, and then they did the ultrasound, and they actually had my PET CT up on the computer, and I was trying to see it to see what I could see what was there, and they're a little misleading if you don't know how to read them, which of course I don't, but I do know that from the first one that like the places they put the radioactive material in you, so now I've gotten that in me twice, and then wherever it lights up, whenever they're doing the reading, where it lights up is where there's cancer, but other parts light up, and I think it's because they say that those parts light up because they're in movement, so like around the bladder. Last time my tongue moved, and so I was looking at it and I could see these black areas, and it looked like, oh my god, looked like there was a lot going on, but apparently not. I think the kidneys also show up on there. So they did the ultrasound yesterday, and then we waited for a while, and then they came and talked to me about doing the biopsy, and I was so nervous about it because when I got the biopsy done the first time, when they did the breast biopsy, it was so, I don't know, maybe it was just traumatizing because it all happened so fast. I think a lot of it had to do with, I got, on 10/17, they did a biopsy, and on 10/22, I found out I had cancer. I think it was just, and then on 10, I can't remember, just a few days before that, I was like even alerted to the fact that I might have cancer, so the whole thing, and then they wouldn't let my boyfriend be in there with me. And that was really hard for me. And anyway, so I was a bit of a baby about it, really. I told them I definitely needed anti-anxiety medication because I was stressed. I was stressed about it. So they gave me some. But it was so sweet actually being in there. It brought tears to my eyes. I was crying because I was so touched by. It was a whole team of women. It was 5 women. The 2 main doctors, and then this really sweet woman whose name was Key, she was really funny and delightful. Both the main doctor and her were holding my hand at one point, and they were like holding my hand and rubbing my hand, and my partner wasn't in the room. He went out. They just decided it would be less distraction, which is probably good because I was cracking up. I was laughing a lot because he always makes me laugh a lot. And so they asked him to just be outside, but it ended up being like the 5 women and me, and I told them I just felt like I was in such good and sweet hands, and they're so gentle and tender, and just, I mean, you'd think that I was the only time that they did it. It's not something they've done like hundreds or thousands of times. They treated me like I was special, really. So I told them that. I told them how great it felt to be in such good hands, and yeah, I was just joking around with them. So it was really, really delightful, super great. I made a bigger deal out of it than it really needed to be, which I'm thinking of my acupuncturist saying that a lot of it is really like the anticipation is much harder than dealing with the actuality of what happens. And I think there's something to that. I think that there's a lot of truth to that. But, you know, it's normal to be anxious about these things. I mean, they stuck, it's right here. I've got a bandage here. They stuck me with lidocaine first to numb it, and then a couple times because I told her last time I could really feel it, and I ended up needing more anyway, so could you just give me more? And she did. And they did what do they call it? A core needle biopsy. So it's like they stick the needle in that is, what do you call it? Hollowed out. The needle is hollowed out, and then they go in and it makes this like click, click, really loud clicking sound. And they're actually taking the tissue. So, yeah. So in 5 days, I'll be able to take the bandage off. And yesterday I iced it all day, and it was actually fine. It was fine. It was a lot less traumatic than doing it the first time. So that's all really good news. I go back on Monday to get the port and another anti-anxiety medication for that. I'm nervous. They're so weird looking. I'd never seen what one looked like until I looked online, and they're alien kind of looking because it looks like you've got something growing under your skin. It looks like you get this worm under your skin and then with a big head or something. It's really odd looking. But it takes 4 to 6 hours for the port placement, so I have to get there at 1, I think, something like that, and it's going to take all day. And then the very next day I go back, I get blood drawn on Tuesday, and then start the chemo, and the chemo is going to be 4 to 6 hours. But one thing I don't know is what the results are from them restaining the original biopsy. So they told me they'll tell me next week, but I am expecting to get the TCHP regimen, the standard regimen for somebody who's triple positive like I am, and we'll see if it varies. I won't know really until Tuesday, but we'll do that, and then we'll spend the night again because I don't know if I'll have nausea and vomit or how that's going to go. And then the next day before we drive back, I'll get an injection of Neulasta, that stuff, which is supposed to help with the vomit and nausea. And then so that's all that. I also got, this morning I went to go have another transvaginal, no, it's transvaginal, it's just vaginal, but I guess trans, maybe inside, vaginal ultrasound because they were checking out my ovaries, because last time, and I don't know what date that was, actually I should look at my calendar, but they were trying to see if it got bigger or smaller or what, and it turns out that it got smaller, so that's really good news. I think last time it was something like 4 by 5 by something, and this time it was, I wrote it down, but like 2 by 1 something, so it basically was at least half as small, half as big as before. So they said that it was a hemorrhage, and I guess these things are kind of normal, but there was nothing for me to be worried about. Oddly, I'm getting like the weird pain on the right side, but the left side is the side that the cyst is on. So, yeah, really good news. I've just had like awesome news 2 days in a row, and I am feeling really ready to cut my hair, which is so interesting. I just have been having it, I've been pulling it back because I'm trying to get used to the idea of not having hair, and so like when it's back, it's kind of like I don't have it. So I'm not sure if I'm gonna cut it first and then shave it, or just shave it. Seems like it'd be a little less dramatic if I cut it and then shave it, but I'm not sure. I might just shave it, and I'll do that after sometime between the first day of chemo and 2 weeks, and the 10th day, because I think that's when the hair will start falling out. So I got one of the wigs that I ordered today, and it's really cute. I'm sure I'll don it in a video so you'll be able to see it. And it made me feel good. You know, it's nice to just have a thing or two to feel good about. There's lots to feel good about, actually. I'm grateful for a lot, but it definitely is a big deal to go through cancer treatment and be in these vulnerable and scary situations. And not know how things are gonna go. So it does feel really good to treat yourself in different ways. And for me, getting a wig is very much a treat. So that's what I got for now. Thanks. Here I am in another gown, smashing. This one's actually kind of cute compared to the other ones.